So AI is taking over search. A lot of people are going into ChatGPT, Gemini, or Claude, and they're searching all the Medicare questions. And it's a great tool. It's just not very personal. So it doesn't give you answers specific to your needs. So today we asked AI the top questions for Medicare because we wanted to see what kind of response we got. We know that Medicare is personal. It is not, and AI has struggles to give personal responses. Let's see how AI does, and let's go into question number one. Question number one, what are the best Medicare Advantage plans near me? So this is a great question because AI can't really give you a response. And if you ask me, which is the best one, I'd say it really depends. Depends on your specific needs. Depends on your plan, on your prescriptions, your doctors, your financial resources, and what works best for you. Not everyone fits into an HMO. But even if you broke down the HMOs, there's chronics, there's duals, there's specific chronics for heart, lung, and diabetes. There's PPOs, there's givebacks. There's a lot of options. It all depends on your needs, and there's no way that AI can give you exactly what works best for you. Question number two is, how can I compare prescription drug plans? And once again, it can't do it. The craziest part is, are you willing to give AI all that information about you? That's a lot of personal information about your health and things like that. And do you really trust it with that much information about you? So question number three is, what are the Medicare open enrollment periods? And AI can answer that. It can tell you about AEP, OEP, and all that stuff. But there's nuances. There's these little key details that could give you a special election period that it might not be able to answer. There's other things about the open enrollment period that it might not be able to answer. So, or there's things that it will give you a response for, but you might not just understand because you're not in the industry learning and talking about it on a daily basis. So, question number four, what are the monthly premiums for Medicare Part B? And AI can answer that. That's an easy one. But do you really want to give it all your financial information so it can determine what your Part B premium is going to be? Why not sit down with somebody where you know that information stays private and they're not going to go out there and try to sell you other stuff or give that information to somebody else and try to sell you other stuff? Why not keep it private with somebody that you can trust? Question number five, where can I get free counseling on my Medicare options? AI will give you a response, which is probably go to Medicare.gov, which is not a bad resource. Fantastic website, a lot of information, but you probably want somebody local to your area that understands the market, the doctors, the hospitals, and how those things work together, which plans work really well with your specific needs. Once again, AI is not personal. Quick pause. If this video helped you answer even one Medicare question, give us a like, comment, subscribe, so that way we can keep on trying to grow this page. Let's get back into this. Question 6. Can I switch Medicare Advantage plans during the enrollment period? Depends on which period you're talking about. If it's throughout the middle of the year, you have special election periods. Example of one. If you are somebody that just got diagnosed with diabetes, there could be plans in your area that have chronic plans that are designed for people with diabetes. If you move, another example, but most of the time you're locked in. AEP, annual election period, you can change to any plan. OEP, you can only change to like plans. You can only change from one Medicare Advantage plan to another Medicare Advantage plan. You can't change from a prescription drug plan to a Medicare Advantage plan. That's a no-no. AI can answer that. But will it be personal to your specific needs? Probably not. Question 7, how can I find out if my doctor accepts Medicare? Once again, it's one of those questions that AI struggles to answer. It'll do a quick search, but it'll always recommend for you to look it up on the carrier website, which is fine. But I believe in unreasonable hospitality, and if you have a great agent, that agent will absolutely go in there and let you know if your doctor accepts the plan. It's making it easier for you as you go and look for your needs. And AI can make it a little easier, but it's not going to go all the way and make it completely easy for you. Question 8. What are the late enrollment periods for Medicare Part B and D? And AI can answer that. It'll tell you the percentages and things like that. But the concern is always, what information are you giving AI? Where's it going? Instead of having a conversation with somebody that can give you your personalized response, that can help you with that answer. Question number 9, how to appeal a denied Medicare claim. AI can give you the steps, but working with an agent that's local to you can guide you through the process and relieve all this stress that comes with filling out the paperwork. And if you fill it out correctly, it's kind of like doing taxes on your own. AI can help you, but sometimes you need to talk to a professional, and that helps relieve the stress behind it. That's why we're advisors and not agents, because we advise you through the process. Question number 10, what services do Medicare Advantage plans typically include? And once again, it'll tell you it could cover dental and vision, but everything is personalized to you and your specific needs. And that's where an agent comes in. And even though you have 2 plans that could cover the same amount, there's these minor details in the lines of every summary of benefits that will tell you this plan covers full dentures, this one covers partials only. And who would know that? An agent that studies it in your specific area. Working with AI is fantastic. I use it on a daily basis. But there's times that you just need a person, somebody face to face. And there's times that you just need somebody that's local to your area to explain things better in a way that you understand, in a way that they can guide you through the process. So don't ever stop using AI. I believe that everyone should use it. But understand that AI can help you up to a certain point. After that, you need a person. AI can advise you, but if you work with our team or with an agent locally, they'll advocate for you. They'll partner with you. They'll guide you to the right decision. So keep on working with AI, but don't forget about the human touch. Here at QIA, we use AI, but you'll always have a real person to talk to. How did AI do? It's fantastic. It's great. We talked about that. But Medicare is not about finding generic answers. It's about the right response for you. For us to figure out the right plan for you, we need your doctors, your prescriptions, the county, your income, how well you do physically, how well you do